Affairs health system to step in with resources. Among the VA's missions, including care, treatment, and testing for the veterans, the fourth mission is to absorb non-veteran civilian or military patients in the event that hospitals overflow in an emergency. But the Washington Post notes that that objective, which was described on the VA's website going back to 2014, vanished last Friday.
Why? Why did it vanish? And by the way, this is not making sense.
No, it's not. I mean, you don't want to be overflowing into the VA, which is strapped in itself.
You know, I saw, I forget who it was. I think it might have been Sean Hannity asking somebody about ventilators. Are we going to have enough ventilators?
No one
and the
answers.
answer was, well, the best way to not need ventilators is to not get the virus. Well, that's just a stupid answer.
The Surgeon General
it's a dangerous answer. It's the same answer the Surgeon General gave Savannah Guthrie earlier this morning. These are not answers for senior citizens from Florida to Arizona, from New York to Washington State, whose very lives are on the line. These are not adequate answers. And for the Surgeon General, Mika, a month in to this crisis, 2 months into this crisis, not answering a question about ventilators and instead saying, well, you know what, just don't get this pandemic. Like it's that easy to will yourself not to get the pandemic, shows that there are a lot of people in the federal government that remain clueless, that don't have the answers we need.
All indications are we don't have enough is the answer. And reference to the VA's congressionally backed fourth mission were removed, as we were discussing, and replaced with information that does not reference the original statement. A spokesperson for the VA claims the mission is still intact, but that hospitals are not yet stretched to need the VA's help. Meanwhile, the VA states it has administered over 322 COVID-19 tests since the outbreak began. Just by the way of comparison, the NBA has tested at least 62 players for the disease within just a few weeks. Joining us now, former Secretary of Veterans Affairs under President Trump, Dr. David Shulkin, and former Secretary of Homeland Security under President Obama, Jeh Johnson.
So, Doctor, how can we best use, if you were in a position to use all of the resources that you had at your fingertips in the VA, what would you be doing right now to help avert this coming crash that so many experts are predicting will come to our hospitals?
Joe, the VA is the largest healthcare system in the country. It employs more doctors and nurses than any other system, and there needs to be a close coordination of federal resources with our local governments and our private sector hospitals. And we need to be thinking about our resources in a shared way. We're going to be asked to respond to a health emergency unlike anything that any of us have ever seen. And there needs to be a very integrated system of care. I think the biggest challenge we're going to have is staffing shortages. The VA itself already has 49,000 vacancies, but what we know from past pandemics is that about 35 to 50% of staff themselves won't be able to work because they themselves may be sick or taking care of people that they're responsible for at home. And so we need to coordinate our staff, our equipment, our physical space to begin to start addressing this. And every day that we don't have that coordinated planning is a missed opportunity.
Secretary Johnson, you, of course, ran Homeland Security under President Obama. Not going to ask you to play armchair quarterback, but just as a constructive question, what would you be doing right now if you were back in that chair? What would you be asking for?
Well, Willie, this is this generation's 9/11, without a doubt. I don't know everything that those in the Situation Room know or at headquarters at DHS know right now. I'd be concerned about asking the following things. One, we're seeing new cases every day here in the United States. Is that because of the actual spread of the virus, or is it because testing is becoming more prevalent, or a combination of both? I agree with what was said earlier by Joe and others. We cannot talk ourselves into believing that testing is not important. You need testing to know who has the virus, but you also need testing so you can track the virus in various different communities and know where we need to surge resources. The goals have to be flattening the curve, as we say, And in addition to that, encouraging the public to engage in social isolation, best practices in terms of hygiene. When you're in the chair, first reactions when you're dealing with a lethal virus, the spread of a lethal virus, are not always the best reactions. We can have an overreaction. For example, I have some real concerns about the implementation and enforceability of a shelter-in-place order by the government in a city as large as this one, New York, as large and as complex a population as this one.
Which the mayor, by the way, in the city yesterday said, get ready, this is coming within 48 hours, perhaps.
Correct. And in a population like New York, as diverse and as dynamic as it is, by the time you think through all the exceptions you would need to impose to a shelter-in-place order to keep this city running, the exceptions would absorb the rule, and you'd quickly become consumed by the complexity of it all. So first reactions are not the best. In a situation like the one we have now, this is a national crisis, you need both political leadership as well as social engagement, social commitment, and public sacrifice. The public itself, through its own good behavior, can make the huge difference here in slowing the spread of the virus and keeping us all safe.
Do you think there comes a moment, because some public health experts have said this, where we look at those scenes of crowds on the beaches and people in bars and everything else, and you say, well, we can't trust everyone to abide by these guidelines we've put out, so at some point do what San Francisco did, shut the city down, or perhaps what New York City is going to do. Do you think there comes a moment where there's a national quarantine becomes necessary?
Well, I think at the national level in Washington, we have to fight the urge to try to come up with some one-size-fits-all solution. I think this has to be state by state, community by community, depending upon the nature of the demographics, the population, the workforce. But at the federal level, we can do certain things to encourage certain behavior. I think Dr. Shulkin is correct. We ought to be looking at the VA. We ought to be looking at each state's National Guard. I would not federalize the National Guard. I'd leave it under state control, but I'd put them in what is referred to as Title 32 status, where the federal government pays for National Guard support. But this has to be a community by community, state by state solution, engaging in social isolation and best practices, without a doubt.
Jeffrey Goldberg in Washington, jump in here.
Dr. Shulkin, just to stay on a theme that Secretary Johnson was talking about, if you had 5 minutes with Donald Trump right now, and I realize that that's a fraught idea, but if you had 5 minutes with him right now, would you advocate for a shelter-in-place order, either for a partial order across America or an all 50-state order? How do you feel about shelter-in-place?
Yeah, my concern is that seeing a doubling of cases now every 4 days, we are unfortunately beginning to follow the epidemiologic curve of Italy rather than South Korea. So I think that we do need to consider getting more aggressive. I think a shelter in place needs to be very geographically determined, but we cannot afford to sit idly by and to watch ourselves turn into Italy. We have far fewer hospital beds than Italy. I don't know if people realize that. Our hospital leaders right now in the private sector are doing an incredible job in preparing, but we are going to see staff shortages, equipment shortages, and if we want to save people's lives, we are going to have to get more aggressive. And I don't want to see us be a few days behind always. I think that we have to be looking forward. We see what's happened in the European countries, and we can't afford to stay on the same curve that we've seen